Hi, everybody. This is Dr. Blevins with Enilda Clinic at enildaclinic.com. Before we get started, I'm going to ask for you to go ahead and hit the subscribe button if you're at YouTube, or sign up for the email list if you're at enildaclinic.com/learning. I remember to do it this time. All right. So I'm very excited today because we are going to be talking about co-parenting. I guess that means whenever the two parents are not married or living together or working together as a couple and they have a child together. So, commonly this might happen after divorce, or it might even happen before the parent, or if the parents never decide to get together or something like that. And so I have a psychologist with me today, all the way from Australia. Super excited about this. So I'm going to read her bio. So this is Tiffany Rochester. She is an AHPRA endorsed clinical psychologist with over 15 years experience working systematically with children, adults, and families in a range of settings, including separation, divorce, and family court issues, children involved in the justice system, families raising children with complex needs, trauma, perinatal mental health, and anxiety, stress, depression, grief across childhood, adolescence, and adulthood. Tiff is passionate about the application of evidence-based practice, and her clinical approach is informed heavily by contextual behavioral science. And for my people, that's getting into ACT. Yeah. So that includes behavior analysis, acceptance and commitment therapy, or ACT, and compassion-focused therapy, or CFT. Tiff supports families through behavioral interventions for children, adolescents, family therapy, couples therapy, and individual work. She enjoys opportunities to run workshops and work collaboratively with schools and organizations, presents at national and international conferences, and has had articles published in professional magazines such as M.App.Psych. Committed to contributing to the science that underpins psychological practice, Tiff has also served as an honorary research fellow at Telethon Kids Institute, conducting an ACT research trial for parents raising kids with autism. Awesome. Tiff has been serving on the board of the A&Z chapter of the Association of Contextual Behavior Science since 2015 and is currently immediate past president. When she has time, she authors thesamemountain.com to provide free accessible resources to families. Awesome. So that's sort of like what I'm doing here with the Enilda Clinic in the US then, right? You got the Australian version?
Yeah, that's a good way of looking at it. Yeah.
Yeah, I love it. So everybody should go over there and check it out. I'm so excited for our conversation today. Thank you for being here, Tiff.
Me too, Leslie. Thank you so much for having me.
Are you originally from Australia?
Yes, I am. I'm from Western Australia in Perth, and I'd like to acknowledge that the land that I'm on is the land of the Whadjuk-Noongar people, our traditional custodians of the land. And I'd also like to pay my respects to our elders, past, present, and emerging, and acknowledging their ongoing connection to the land here.
I love it. I love that so much. You guys are ahead of us on cultural respect. So that's something that I think we can aspire to.
I would love to think that was the case, Leslie, but we have a very, very long way to go. A very long way to go.
Yeah, probably we all do. Okay, so let's jump right in. Can you tell me, what is co-parenting therapy?
So co-parenting therapy is really about bringing together parents who are no longer parenting the same household, but still have children that they are raising together. And it's a really difficult situation because these are two people who usually, really cared about each other at the time that they decided to bring children into this world, and that relationship has come apart. But there is still the very real intention in both parents to be able to raise really healthy children, and that's a very, very tricky thing to figure out. It's tricky in the immediate time. If you think about these parents, it's immediately post-separation. There is so much emotion, so much pain and fear and worry on behalf of the parents, in that first couple of years. And then ongoing as the children grow and develop, and the parents also want to move about in their own new lives apart from each other, looking at how they still raise these children together is a really, really complex area.
Yeah, and I love the fact that it's all about the intention of what's best for the child, and also acknowledging the fact that You have respect for the other partner. The other partner wants what's best for the child too. That's really awesome. I think a lot of times whenever I'm working with parents, you know, they definitely want what's best for the child. And I know just getting them to that point of understanding that everybody wants that, that can be such a breakthrough. It's amazing. So tell me, what might be, I guess, the most common situation that leads, I don't know if it might be one parent or both parents reaching out to you to seek services?
Yeah, look, the first thing that I just want to cue people into who are listening to us and watching us is that the bulk of children who are being raised by separated parents grow up just fine. And the bulk of parents who separate really well and manage to figure this stuff out. So one of the things that I just realized that people who are early in this journey is your kids are probably going to be fine. So what we know when we look at the research literature is that there are higher risk factors for kids who come from separated homes, and that impacts about 20% of kids who are growing up in separated families. What I would say to parents who are early in this journey, or actually at any point that they're in this journey, is that a little bit of time in some preventative work saves you a lot of time later on. So sometimes I'll have conversations with parents wondering about whether it's too early, whether the worries that they have aren't big enough yet to involve a professional. And I would say that's the ideal time to come in and say, hey, we would really like somebody to give us some pointers around this. And I think particularly because, you know, that view that we both have is that parents really care so much about looking after their children's best interests. But in that space of separation, it can be really hard to know what that actually is for their child in that moment. And there are so many people with so many emotional experiences and so many thought processes that it can be really hard to tease apart what belongs with the parent, what belongs with the child, what parents should and shouldn't be sharing back with their children. So there are multiple ways through to seeing a therapist for some co-parenting. The ideal would be for the two parents to talk to each other and say, this is tough, we're having a tough time, let's go and get some guidance in how to do that. But it can also be led by one parent or the other. And certainly in our context here in Australia, if a parent wants to take a child to a psychologist, or a parent wants to go and get some help themselves, there are kind of two different situations there. Often when they first come in, the parent will come in for help for their child, and we'll look at that and go, actually, this sounds like it's more like a co-parenting issue than an issue with the child. And in our case over here, we are ethically obliged to contact the other parent unless there are issues of risk and concern. Yeah.
So over here we have parenting plans, well, at least in the state of Washington, so every state's different. But in the state of Washington, I always ask the parent if they have the full right to consent for the child. And if they don't, then of course they already know they have a parenting plan. So I just ask to see the parenting plan, and that tells me what else happening. But if the parent has full right to consent, then I'm not obligated to share anything with the other parent at all.
Right, so you tap on something really important. And the same here, we don't have a legal imperative, but we have under our code of ethics, we have an ethical imperative to, wherever possible, to involve the other parent. And that's really important, because sometimes the very strategies that we might be putting in place to support a child might be a little off kilter because we don't have the full amount of information in front of us. So it's really important to work with both parents and both parts of that puzzle.
That totally makes sense. I'm just imagining the numerous families I've had in the past, if that were the case, like how things might have gone differently, not necessarily in a better or a worse way, but in different ways things would have gone.
It's so true. And we're seeing a fabulous change here, particularly in Western Australia, which is obviously where my knowledge base is. So when I first started doing this work with families, most of the families I would see were mandated. So it was, they'd been before a magistrate or a judge, and they had said, you guys need to go and see a family therapist to sort out your co-parenting. But by this point, they'd often been in the legal system for 7 years and spent hundreds of thousands of dollars on lawyers and legal fees and days in court. And family therapy was kind of like the last option. Like, we've got nothing left to throw at you, try this one. But thankfully, we are now getting families far earlier in the piece, and lawyers and magistrates are recommending family therapy as a starting place rather than a finishing place, which is fantastic, because if we can invest in co-parenting and sorting out how to get that on track together, then there are, and I really can't overstate this, there is hundreds of thousands of dollars of savings to families in court fees, in lawyers' fees, in engaging in really good family therapy. And then that money can be spent buying houses or holidays or college funds, a whole heap of other really, really fun and meaningful things, rather than funding a horrible, stressful court process.
For sure, for sure. Yeah. Yeah. And I think what I've seen with a lot of families is the court process oftentimes is amplifying any disagreements that the parents have with each other. And so even just cutting that off sooner and getting into more of a therapeutic process that generates empathy across the parents and empathy for the child and the situation that they're in, maybe it would even lead to a lot less bad situations happening that generate all of the hard things that later come after the divorce. Ooh, gracious. But I love the fact, it's complicated, but I love the fact that you guys are getting more into a preventive approach. I've had, parents call me and say, I'm just worried about my child, managing through the divorce, but I don't really know if they should come in. Kind of what you were just mentioning. For that parent, what would be the typical treatment? I mean, not treatment. I guess you would kind of flip it and say, well, it's not necessarily the child that's going to need treatment. It's going to be more the parents for teaching you how to do some things.
Yeah, very much so. I think I love kids, I really do, and all across from the very small through to your prickly adolescents, but I love them so much that I don't want to be that key person that they come and talk to unless there is no other option. Like, I really want those young people to be connected back to mum and dad, that they can be the people that they go to talk to about their big feelings and their really difficult thoughts. So one of the things that I'd really want to say to parents is, parenting truly is, I know this gets said a lot, but it's really true. It is the toughest gig. It is the toughest gig. And if you're parenting in a separated context, you have just completely gone up like 10 notches on the salmon ladder. Like, it's massively harder. And so getting some help in knowing how to parent through that is a really, really useful way to just get some more resourcing for yourself, to not carry it all on your own. And then in terms of, what we'd look at with that is a lot of helping parents know how to sit with their children's distress, and how to sit with their children's kind of process of figuring out, how do I love two people that don't love each other anymore? And how do I make sense of moving between two homes? I guess all the complex developmental tasks that are in there. And if you can think about these parents, because they care so much about the development of their children, when the children are really distressed by what the parents have had to do, that can be an incredibly painful process for parents to have to show up to. So getting some support around how to sit with your own distress in the presence of your child's pain, knowing that how to have compassion. I was going to say knowing how to not take on guilt, but you can't. The guilt's going to come. It's going to be a free rider. But knowing how to have some real care and compassion for yourself
Yeah.
while your child is having that distress.
Mm.
Yeah, I think that would be really useful. And then looking at what parenting, authoritative parenting looks like in that space. How do you set limits with a child who's going through a hard time? What are normal behaviours around transitioning from one parent to another? There's a lot that's really, really tricky. And the other thing I find myself often wanting to talk to parents in this space is that, unfortunately, we don't have a lot of good cultural modelling about how to do healthy separations and healthy parenting. If we look at our mainstream movies, if we look at, you know, the series that we like to watch on our favourite streaming services, we have parents who often, they do not speak to each other. We have a goodie and a baddie. We have most of our superheroes come from, you know, abandoned parent stories. What we don't see a lot of is separated parents who know how to co-parent really well together, and a modelling of that. So we don't have that modelling in our kind of cultural story to follow, which makes it even harder, I think.
Yeah. It's almost like potentially just following a script, not even realizing that there is a whole potential for a very positive interaction, and your kids at some point generating some acceptance of the situation and feeling positive. I mean, we know kids at some point will anyway, but maybe a bit quicker, a bit easier. So you mentioned just a minute ago that there are some tricky things that the children can go through. And I know we know some things about different ages, different genders. Is there anything, let's go with just like the young kids. We'll kind of break it up, like young kids, the middle-aged kids, and then teenagers. Anything that parents might see that would say, yeah, let's go ahead and go look at some co-parenting therapy.
I've been thinking about the different behaviours that we see in the children. I would think so much of it would come back to, rather than looking at the behaviour of the children, looking at the behaviour of the parents. So one of the things that I would look at is, as a parent, if you don't know how to talk to the other parent, if you notice your own flight or fight rising at the very idea of having to send them an email or a text or a call, if you don't know, you know, if you get nervous around how to do a transition, if you're concerned about the behaviour of a child moving between the homes, if you don't know how to raise information that you hear about the child with the other parent, or when they're with the other parent and the child comes back to you and they tell you the stuff that children tell you, you don't know what to do with that. So that would be the first thing, is to tune into your own process, because a lot of the problems that we see later on down the track in children, they start there. So the way that it might start is that, you know, we might have a mum who you know, is having difficulty getting her child to do a scheduled call with dad. So she might say something to the child like, oh, well, you have to tell him that that you don't want to talk to him. And in that moment, that gets the mum out of that situation, right? I've popped on the child can take responsibility, but also in that moment, she's popped responsibility on a child's shoulder that doesn't belong there. It's not a child's decision about whether or not they have contact with another parent. That's a parenting decision. And she's also created a special rule there, because if we have that same kid saying, I don't want to go to maths class today because I really hate my maths teacher, then in that situation, she might actually get a kid off to maths class, but she's got a situation where she's not helping the child make a phone call. So the first thing I do is look at, as a parent, how do you feel about communicating with your co-parent? And if that is stressful and scary and hard for you, jump in quick to get some help around that. Don't carry that on your own.
Yeah, I really like how you just described that, because all the examples you gave are examples that I hear from the parents I work with who are in this particular situation. And it often does lead to, I mean, the parent's focus is on the child's behavior, right? The parent is sitting there saying, well, they won't call their dad. They don't want to be on the phone with their dad, like things like that. So I love how you it's just like, I did an interview with a nutritionist the other day, and she talked about the parents' responsibilities for eating versus the child's responsibilities for eating, and just really making it super clear. And so I love how you're defining it that way too, that there's some anxiety with the parents' responsibilities for setting up the structure of this now two home living situation. And maybe that's what's making the kid look like they have a worse presentation than what they might.
Absolutely, and I think one of the things that that we'll see a lot is we'll see where a child resists going to another parent, and that would be again another indicator. If you've got a child who is starting to resist going to the other parent, that would be a definite time to get some help. And when you're looking at that help, what I'd really be encouraging parents to go is to go and look at what is it. You know, you care about your child and you care about your relationship with your child. So I'd really want you to be very open with what is it that I might be doing that might be contributing to this. And I'm going to trust that my co-parent is going to do a similar level of investigation into what they are doing. And one of the reasons for that is that if I just want to blame my co-parent for all of the problems that are happening for my child and in our family dynamic, I'm handing over all of my power to somebody that I have no control over. And then if I add into that I don't like that co-parent particularly, I don't want to give all of my power to somebody that I'm not keen on. But the other part is that if I love my child enough, and we do, right? If I love my child enough, then I really want to cue into what on earth am I also doing that might be accidentally, inadvertently making things worse. And so again, some of the things that we might see is, you know, if I don't like my co-parent, I might be less likely to have photos of them up around the house. I might be less likely to talk positively about them, or I might have a particular facial expression that goes across my face when my child mentions something they've done, or it might be that when my child mentions that something doesn't go well with a co-parent, that I jump right in on that. I'm like, yeah, you know, can you tell me more about that? Like, oh, hang on, geez, that does look like it might be bruising your arm. Let me get my camera. I want to take a photo of that. And there's a whole heap of ways that we can be very subtly messaging to our child that the other parent is not safe, or that we're not okay with them spending time with the other parent. And our children have to learn how to make sense of that. And so one of the ways that we'll see is that things might not be brilliant with this parent over here, but there's also stuff happening right here that we can start to tackle and look at.
You know, the thing that's occurring to me, I love the fact that you guys are ethically obligated to work with both parents, because I could see in myself as a provider having a greater sense of trust, just having the perspective of both parents and understanding situations that have been, you know, relayed by, you know, like a 4-year-old, like getting better information. And unfortunately, that's not typically how it works. We're just working with one parent, and in that situation, what I encounter is, and most of the time it's a mom, not always, but most of the time it is, what I encounter is that the mom is pretty fearful of the co-parent. And, you know, sometimes there might be a domestic violence history. So sometimes it's like there's a legitimate historical past history of behavior to be fearful of. And then sometimes it's just that they're not confident in that person's parenting skills because they've never had to parent before. So why would they suddenly be able to for 2 days in a row? You know, what are your thoughts on that? I realize it's different in Australia.
Yeah, well, yes and no. I mean, we'll definitely have that happen. And look, I mean, one of the things that I want to say straight up is for those parents that are in that situation where they've, you know, often relationships have ended for really good reasons, for really protective reasons. And then it becomes even harder when you're looking at the person that you have experienced violence from is also your co-parent, and figuring out what you need for your own sense of safety, but also what your child needs, in making sense that 50% of their DNA comes from that person. and that if they are not having contact with that parent, not only are they're losing that connection back to their DNA, their history, and the whole other half of their family. There are a huge number of losses. So coming back to that, we really have to come back centering on what is in that situation in the best interest of that child in that family history. And that's going to change from family to family. So it might be, I guess some things that I would look at is, if it is a DV situation, what processes within the legal system are in place to be able to help the co-parent get some support to learn some different ways of being. And I think that really, I have a lot of passion for that work, because if we have a perpetrator of domestic violence and all we do is we just have to make sure we protect everybody, keep everybody away from them, then we're only protecting these people over here. We're not protecting all of the other people that they go into future relationships with. But if through a legal process, and that's not the person who's left that relationship's responsibility, but if a legal process can require that person to attend some training or therapy, then we can help that person learn some better coping skills and better emotional regulation skills, so that nobody else becomes a victim of their violence, including the child. And then what I would want is somebody in that system who can track what is that parent's capacity to be safe with that child, and for how much can they be safe with that child. So there'd be some children that I've worked with where it is unfortunately not an achievable goal that they would have a lot of unsupervised time with their other parent, but we might be able to get them having a milkshake once a month in a public place. So that parent might be able to do those things safely, or that parent might be able to attend assemblies, or might be able to go and watch a netball game, and that in those settings the child still has access to their parent in a way that is safe and protected, but a way for them to also make sense of who they are in relation to that person. When we completely remove that child from that person, and there would be circumstances, of course, where that is an appropriate thing. Like I want to be really clear, there's such a massive spectrum here, and the bulk of the time when I'm doing this work, it's with families where it's been deemed by the courts that some level of co-parenting is safe and possible. So that would largely be where I'm talking from. But to protect the safety of the child and give them as much healthy contact as is possible for the parent that they do have.
Right.
Did that answer that question? That was a lot of talking. Sorry, Leslie.
No, it did. I'm putting it in the context that I understand here in the US. I feel like maybe Australia is a little bit more further along with the prevention, like mandating the family therapy or the co-parenting therapy, or even just like parenting skills classes, or all those different features that you're talking about. Here, it seems very difficult to get anyone to do that. I've worked with a couple of our guardian ad litems, and there are people who oversee children in these legal situations. Whenever the child, we're having a parenting plan being created in the court or whatever, we have a guardian ad litem, which is just a third-party lawyer assigned to the child to look after their best interest. And I feel like even they have shared with me that they feel very hesitant to ever request too much mental health on either of the parents. It's just kind of, mental health is still very stigmatized here. Which is why I do the videos. One of the reasons why.
Look, and I notice, my heart just aches in that piece, because this is separating out from the co-parent of your children. I can't imagine that there are many things that are tougher to navigate. That is such a hard burden that parents are being asked to step through.
Yeah.
And so, I'd really want to say to anybody who's watching this is, get some resources in your tank. Whether or not you want to call it a mental health issue, call it this is really, really hard and I should not have to do this alone issue. And your child is worth it. And damn it, you're worth it. Like, call it for yourself. You're absolutely worth it. You're worth having, when you separate, I mean, one of the parts in that is that, you want to get back to having a life that has meaning and value for you. You want to be able to be your authentic self. And I don't know. I don't know for sure what happens other than the fact that I'm born and I die and there's this time in the middle. And if that's the only part I can guarantee, I want to take the shortest pathway through to having, the most awesome, valuable, connected time that I can have. So, so don't wait for people to give you permission to take the resources, is what I say to parents. Go out and grab them. There is the Association for Family and Conciliatory Courts, and that's international association. And there are quite a few. In fact, I think its home base is in America. And so whilst it might not be huge, it's definitely growing. There's a lot of really strong, good practitioners and academics who are doing a lot of work in this area. I know in some states in the US, there's parenting coordination roles, which we don't have over here, and I'm quite envious of that being an option over there for families. But the other thing that I'd say is we've seen rapid change in Western Australia just in the last 7 years in terms of, as I said, these cases being recommended for co-parenting support far earlier. And I really hope the same thing happens there.
Yeah, me too. Oh my gosh, it'd be amazing. Amazing for the children especially, but then also just the stress on the parents. I think it would really go down. Do you have, like, you might not know any outcome data off the top of your head, but what's the general feeling that the courts have now that they're doing that?
So look, to give you an example, I had a parent recently, there was some issues with their orders, and we had a quick conversation about them in our session together. And came up with an alternative that we thought would work. And then she went to a mediation process, and at the mediation, the mediator said, sure, you can spend $3,000 on your day in mediation, but it sounds like in your family therapy process, you already have an answer. The two of you can just agree to that and put that change in your orders. So I started answering your question now. I've forgotten exactly what your question was.
What is the court think?
That's what it was. Yeah. So I guess anecdotally, one of the things that I found is that it is not uncommon by the time a family comes to me that they have spent somewhere between $100,000 to $400,000 on legal fees. With the families that I've yes, and that's before they've got to a trial for their final parenting orders. I don't have that kind of money. I don't, and neither do they. I think about the number of them whose their own parents have spent their retirement funds to help fund their children's legal costs. It's way too much money. Comparatively, we've found that if across a family system they invest around $10,000 in family therapy, that they can avoid trial and get co-parenting happening in a really functional way. So that's a fraction, and that's, so that's 5,000 a co-parent. So what I would say to parents, if you're thinking about whether or not you want to give this a go, is look at how much you're budgeting for a trial, and then halve it and halve it again, and say that you would spend that on family therapy, and then spend a fraction of it and take the rest of that fraction to take your family on a really cool holiday when all of the borders are open and it's safe to do so.
Right? Yeah, that's the best sales pitch I've ever heard for therapy. That was really good. And it's so true, right? It's so true. And especially with children, like almost every single difficulty is better managed in prevention. But then as soon as the difficulty starts to pop up, just address it. Don't wait and expect that it's just going to get better on its own. And yeah, I love it so much. Okay, so I'm wondering, I'm trying to think if there's another question. I know we talked about some questions before we started. Is there anything I haven't asked you that you think the families out there are going to want to know?
Look, there's a couple of things that are bubbling there. So one is to just remind every parent that transition days suck for children and they suck for separated families. So if your child is having difficulties transitioning from one house to the other, that doesn't necessarily mean that you're doing anything wrong. It doesn't necessarily mean that the other parent is doing anything wrong. It's just that on that day, that's when the child has to butt up against their two loyalties, that they love two parents and those parents don't live together anymore. So that is really, really normal. Have loads of compassion for your kid and have loads of self-compassion for yourself. Transition days are hard. The other thing that's sitting there for me is that I find that I'm often saying to parents is that you want to fight for what works, not fight for who's right.
Mm-hmm, mm-hmm.
And
Hallelujah.
yeah.
Hallelujah. Oh my goodness.
So I will often say things to parents like, if you have to contact the other co-parent, imagine you really like them. Like imagine you're writing to your mum if you really like your mum. And write to them that way. Why do you have to like them? You do not have to like them. But if they get an email where they feel like they're liked, where it's kind, where it starts with a, dear co-parent from co-parent, then you're likely to get a better response back. And it's worth doing it for that. Don't do it because of the other co-parent. If you really don't like them, that's fine, but do it for yourself. So any time that you can make it easier for your co-parent to engage with you, you are making it easier on you. So definitely look at, what do I need to do to get this workable, rather than do I need to be the person who is right in this.
Right. Oh gosh, no truer words were ever said. I'm gonna put that on the cover for this video. That was amazing. Amazing. All right. So I'm trying to think if there's anything else. I feel like the parents who watch this are going to be like, Leslie, you should have asked like 10 more questions that we have. But I don't have them in my brain right now, guys. I'm sorry. I'm so sorry.
You're lovely to talk to, Leslie. So if it turns out you get a stream of questions, then we'll just book in another time. This is a great way to spend some time together.
Yeah. So that everybody knows out there, Tiff just started her day over in Australia, and it's a Sunday night here, and I just put on makeup, which I can never tell that I have on makeup. Once I go back and look at the video to see that everything's correct, I'm like, looks like I did not get ready at all. But I just put on some makeup on a Sunday night, and I'm about to go wash it all off and go to bed.
It's true. I'm totally in the future. And I made a joke to a friend of mine in Canada on New Year's Eve that I said, I've beat you to 2020 and it's awesome and it's the best. And what I've learned since then, looking at 2020, is I'm not going to make predictions about the future for you. My Monday morning is going well. I really hope that yours does when you get there.
Yeah, 2020. No more predictions. I tried to think of the worst possible thing that could happen, and I think I did like a fun little online bet. It wasn't real money, just like friend bet for August, and I think I said like, oh, we're gonna get a big bacteria in the ocean. It's gonna kill our entire food supply. That didn't happen, luckily, but we got 2 hurricanes that like crossed each other down in the Gulf Coast, and that's where I'm from. So it's like, so we just got 2 hurricanes that just smacked right into us. So, yay.
We are certainly learning that 2020 is our year of learning how to absolutely live in the moment and do what matters while we can.
So you see that back there? That's my Buddha board. Have you heard of a Buddha board?
Yeah, I have heard of them. Yeah. Tell me
just heard of it. Yeah, just heard of it. I just did it for the first time right before this video. I painted something on it, and I didn't think that it was really going to have any kind of effect on me, but I painted it and immediately it starts to disappear. And I'm like, no, no, no. It was so interesting because I was like, wow, I really do have difficulty living in the present moment. Just like, yeah. So I'm going to do it every day. So guys, a Buddha board, which I have another video about that I made right before I made this one about Buddha boards, is just helping you live in the present moment. It's helping you watch your thoughts fade away and accepting that fade away because you can't do anything about it because it dries and it disappears.
And I love that moment that you shared, Leslie, about that. You know, this is stuff that we talk with parents and children about, and it's stuff that we have to practice ourselves all of the time, that we are just as human as everybody else.
Oh yeah, for sure. For sure. Yeah, 2020 for me has been all about learning how to live in the moment, give myself some self-compassion. I think I told you before we started, I just did a no electronics day for the first time in my life yesterday. It was the best thing in my life. Best thing in my life. I'm going to have them so much more now. All right. Well, I won't take up too much more of your work day. And thank you so much for being here. Thank you for talking about co-parenting. I know that parents are really going to appreciate this. I've already thought of several people that I'm just going to send this video to because I think they're going to find this information so helpful. So thank you again. I really appreciate it. And where can people learn more about you, and especially your learning videos too? Because over here in the US, I know people will probably want to reach out and learn more about what you have to say.
Yeah, look, absolutely. I'd love that. So my website is thesamemountain.com. And on there, I've got a bunch of posts, as you read out in my bio, when I have time to write them. But I've also got a series of videos and specifically some training resources coming in the next few months, specifically for parents who are in this situation. And particularly because there can be long wait lists to see people who will do court-involved work, and it can be, even though it's a fraction of the court costs, it's still money. So I'm really passionate, like you, Leslie, to find accessible, more affordable ways to get this information to families when they need it.
Yeah, for sure. Thank you so much for that. And guys, I'll have the link in the show notes wherever you're watching this video. Subscribe if you're at YouTube and go look in the description. You can find The Same Mountain there, the website there. And then if you're at enildaclinic.com, go to enildaclinic.com/learning and you can sign up for the videos and get them in your email each week. All right, guys, I'll see you next time. Bye.